Hello, welcome to part 52 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 256. A patient reports weakness and tingling in the lower extremities in the past 2 weeks. The physical therapist suspects that the patient may have Guillian-Barré syndrome. Which of the following examination findings would most likely occur with this diagnosis? Option A, hypertonicity in the affected muscles. Option B, presence of clonus with rapid passive foot dorsiflexion. Option C, diminished tendon reflexes. Option D, ataxic gait pattern. And the answer is Option C, diminished tendon reflexes. Explanation for this question is, Guillain-Barré is a lower motor neuron disorder. Diminished reflexes are expected with lower motor neuron disease. Options A and B are found with upper motor lesions. Ataxia would be much more common with cerebellar disorders. Now let's move to question number 257. A patient who has suffered a cutting injury to the entire left half of the spinal cord at the T8 level is being examined by a physical therapist. Which of the following impairments would be most apparent on the ipsilateral lower extremity? Option A, loss of pain and temperature sensation. Option B, loss of movement and light touch sensation. Option C, loss of peripheral smooth muscle control. Option D, loss of coordination and accuracy. And the answer is Option B, loss of movement and light touch sensation. Explanation for this question is, Option B, these pathways decussate in the brain stem, and Option A, this would be lost on the contralateral lower extremity due to the decussation of these sensory afferent fibers, and Option C, this is not correct at all since arterial smooth muscle relies wholly on adrenergic receptors. And Option D, this would be caused by an injury at the cerebellar level. Now let's move question number 258. A 10-year-old presents with pain and limited roam following surgical repair of the medial collateral ligament and anterior cruciate ligaments. The modality that would be contraindicated in this case is Option A, interferential current. Option B, shortwave diathermy. Option C, transcutaneous electrical stimulation. Option D, ultrasound. And the answer is Option D, ultrasound. Explanation for this question is, ultrasound energy may affect the epiphyseal areas causing bone growth disturbances. The epiphyseal plates close at the end of puberty. Now let's move to question number 259. A patient with Guillain-Barré syndrome has bilateral lower extremity weakness. Which of the following descriptions best represents the underlying cause of this disease? Option A, lower motor neuron demyelination. Option B, cerebellar tumor formation. Option C, vagal nerve axonatomesis. Option D, amyloid plaque formation. And the answer is Option A, lower motor neuron demyelination. Explanation for this question is, Option A, Guillain-Barré syndrome is a lower motor neuron disease where the myelin sheath is destroyed, thus eliminating nerve conduction, and Option B, this would result in ataxia and uncoordinated movements. And Option C, this would result in loss of vagal control and would be trouble. And Option D, this is the common symptom of Alzheimer's disease. Now let's move to question number 260. The physical therapy intervention for a patient with dark skin pigmentation includes superficial heat. After 5 minutes of this intervention, the physical therapist removes the heat and observes that the skin over the region being treated is blotchy with both darker and lighter areas. What is the most appropriate action for the therapist to take? Option A, discontinue superficial heat and initiate ultrasound. Option B, continue with the use of superficial heat, as this is a normal response. Option C, discontinue superficial heat and initiate diathermy. Option D, continue with the use of superficial heat, but add more towel layers. And the answer is Option D, continue with the use of superficial heat, but add more towel layers. Explanation for this question is, there is no reason to suspect that the modality must be changed. The first logical step is to increase toweling. The patient's response is not a normal response. Uneven blotchy red and white skin in a light-skinned patient or darker and lighter areas in a darker-skinned patient could be a sign of overheating. 5 minutes after initiating heating, the physical therapist should remove the pack and check the patient's skin for any blotching mottled erythema. If it is found, the heat is too intense, and adding more towel layers would be the most appropriate action. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 53. See you till then, bye bye.